presentation, I would like to present to you some preliminary findings from an ongoing prospective cohort study describing exercise practice and the incidence of veterinary events in thoroughbreds between birth and 6 months of age. I would like to acknowledge the contribution of my co-authors, my PhD supervisors Christine Verheyen and Amanda de Mestre, and postdoctoral researcher Juan Carlos Arango-Zabagal. I would also like to thank the participating stud farms and their veterinary surgeons, in particular Rossdale's veterinary surgeons and equine reproduction services. There are no declarations of competing interests for this work. Funding for this study was provided by the Racing Foundation, the Horse Race Betting Levy Board, and the Royal Veterinary College's Fund for Equine Research. Ethical approval was granted by the Royal Veterinary College's Clinical Research Ethical Review Board, and owner-informed consent was obtained for inclusion of animals into this study. Studies analysing studbook data have suggested that only around half of all thoroughbreds born in the UK for the purpose of racing make it into training, a fact which raises significant economic and welfare concerns for the industry. The British Horse Racing Authority's recently published welfare strategy highlighted the need for improvements in the traceability and transparency of the fate of individuals during this period. However, to date, limited information exists on the health and husbandry of young thoroughbreds between birth and entering training. Applying the developmental origins of health and disease principle to available evidence would suggest that early life exposures, in particular exercise, may be critical to an individual's predisposition to disease and injury, and hence its ability to be retained within the industry and fulfill its maximum athletic potential. As such, further work to describe management practices, quantify early life exercise, and provide baseline figures of disease and injury during this early life period is required. Hence, the objectives of this study were to describe early life exercise practices and estimate the incidence of injury and disease between birth and 6 months of age. A prospective cohort study was set up with foals enrolled at birth. Participants were asked to record daily the location and duration of any turnout individuals received. Periodic visits were made to collect data and access farm and veterinary records from which events where foals received veterinary intervention were identified. Events were classified as either routine, for example vaccinations, or new, where foals required veterinary intervention for the investigation and/or treatment of a new health condition. Exercise data were described in periods of 30 days of foal age. Within each period, the average turnout time in hours and area of paddock in acres per foal per day were calculated. Results were further stratified by farm. Differences were assessed using Kruskal-Wallis tests with significance set at p less than 0.05. New veterinary events were further categorised by type of pathology and body system affected. Further subcategories were made where case numbers allowed based on case definitions created from available literature. Incidence rates were calculated using time to event data, excluding repeated events within foals. Results were further stratified by farm, and differences were assessed using log rank test for survivor function, with significance set at p less than 0.05. Since submission of the abstract, complete data for the cohort have become available, results of which will be given in this presentation. The cohort was comprised of 206 foals recruited over 2 breeding seasons, 197 born in 2019 and 9 born in 2020. Half were colts, half were fillies. Foals were born between January and May, with just over a third of the cohort born in March. Foals were born from 203 mares, with 3 mares appearing in both seasons. Mares were covered by 97 different stallions. Foals were recruited from 7 different farms, with 1 farm appearing in both seasons. The mean number of foals per farm was 29, and the mean farm size in acres available for grazing was 233. Exercise data were only recorded by 6 of the 7 farms, resulting in turnout data being available for 124 foals. Daily exercise data were not normally distributed, hence median values were described. Figure 2 on the left displays the median daily turnout area per foal for each category of age of foal at turnout. Significant variation in median daily turnout area per foal was observed between foals aged 0 to 1 month, 1 to 2, and 2 to 3 months of age at turnout. During the first month of life, paddock size was on average approximately 1 acre. This increased to approximately 3 acres for the second and to 5 acres for the third month. Past 3 months of age at turnout, there was no significant variation in median daily paddock size between month of age of foal at turnout for the cohort as a whole. In figure 3 on the right, the results are displayed stratified by farm. Farm 5 left the study after 3 months. At the farm level, significant variation in median daily turnout area per foal was observed within all periods of foal age at turnout. In figure 4, the median daily turnout time in hours per foal is displayed for each period of foal age at turnout. The median daily turnout time per foal varied significantly between foals aged 0 to 1 month, 1 to 2, 2 to 3, and 3 to 4 months of age at turnout. Foals in the first month of turnout received on average 4 hours of turnout per day, compared to 6 hours in the second and 16 in the third. By the 4th month of life, foals were turned out on average 24 hours a day, which did not vary significantly between month of age of foal at turnout thereafter for the cohort as a whole. In figure 5 on the right, the results are displayed stratified by farm. At the farm level, significant variation in median turnout time per foal was observed within all periods of foal age at turnout. 670 veterinary events were identified from available records. 25% of these were categorized as new events, which affected 56% of the cohort. A summary of the most common categories of new veterinary events is given in Table 1. Developmental orthopedic disease was the most common condition requiring veterinary intervention within the cohort, accounting for 38% of all new events and affecting 21% of foals. Flexural deformities followed by angular deformities were the most common presentations of this condition. Traumatic lesions of the musculoskeletal system, which excluded superficial skin wounds, were the second most common condition observed to require veterinary intervention. In total, 6 foals died or were euthanized between birth and 6 months of age. Figure 6 on the left displays the incidence rate of musculoskeletal disease and injury in foals between birth and 6 months of age. The rate for the cohort as a whole is given on the left of the graph in black, and rates are then given stratified by farm in grey. The incidence rate of musculoskeletal disease and injury within the cohort requiring veterinary intervention was 10 cases per 100 foal months at risk. Rate figures such as this could be interpreted as a farm with 100 foals would have 10 cases of musculoskeletal injury or disease per month which required veterinary intervention, or a farm with 50 foals would have 5 cases per month. Figure 7 displays the rate of developmental orthopedic disease between birth and 6 months of age in the same format. The rate of developmental orthopedic disease requiring intervention in the cohort between birth and 6 months of age was 6 cases per 100 foal months at risk. Rates of developmental orthopedic disease were observed to vary significantly between farms. The main limitations of this study were that the self-selection of participant farms may affect the generalizability of findings. The use of veterinary events could underestimate disease within the cohort and may be biased by between-farm variation in levels of veterinary intervention. In conclusion, musculoskeletal disease and injury, in particular developmental orthopedic disease, are important conditions of foals in the first 6 months of life. Early exercise varied significantly by age of foal at turnout and between farms, and may affect the risk of musculoskeletal disease. Please find a list of references. Thank you very much for your attention, and I look forward to your questions.